And thank you all for joining us today. My name is Crystal Littlejohn, and I, along with Liz Barlow, am the Aging Life Care Association co-chair for the Diversity and Inclusion Task Force. Like many of us across the country, the Aging Life Care Association was jarred by the many tragic events of 2020 that caused systemic racism to become a part of the national consciousness. Beginning in March 2020, the ALCA Board of Directors began to identify existing members of our organization who could help address and work towards adding diversity to our leadership and membership. It has become clear to our task force that education is an important pillar to effecting change not only in the complexion of the membership, but also for our service recipients. We envision more such discussions in the future that reflect the true makeup of our nation, and we hope that you will continue to join us. Again, thank you for your interest and attendance regarding this vital topic. With that, I would like to introduce you to Liz Barlow for an introduction to our moderator.
Thank you, Crystal, and welcome everybody. So glad you could join us today. Apparently, we're going to have several polls that we're going to ask you to participate in during our presentation today. And I'd like to please encourage all participants to take the first poll. Thank you so much. And at this time, I'd like to introduce our moderator, Abby Udochi. Abby is an ALCA member and proven leader in the public health insurance industry. She is currently the CEO of Concierge Healthcare Consulting, which is a white glove care management practice based in Westchester County, New York. She founded this practice because of her desire to make healthcare options easier to find and understand, and to simplify navigation for those who are sick or aged. Please welcome Abby Udochi.
Thank you, Liz, very much. And thank you, Tani and Crystal and ALCA staff and the Diversity Task Force of the Aging Life Care Association. It's a pleasure to be here, and I do appreciate this forum today. For all of those who are listening, welcome. We are happy that you are with us. This will be a casual conversation with two wonderful experts, one who we will present to you and the other we will introduce to you, but I'm sure that you will enjoy both of them. There'll be time for all of you to ask questions at the end of our conversation. So you should use the Q&A box feature to post your questions throughout, and we will get to as many as we can once the conversation is completed. And I just want to inform all of you that our session today is being recorded. So on to our first poll, and that question is, I hope everyone had the chance to respond. The first poll asks, just so that we can get a sense of experience in our room, what percentage of African American clients are you currently serving? So close to a quarter, 24% have said 0, and 65% have said between 1% and 5%, and 8% have said up to 25% of your clientele is African American. 2% of you have said up to 50% of your clientele is African American, and 2% more than 50%. So thank you for responding, and those are really interesting statistics. Thanks, Courtney, for putting that up. All right. Okay, so on to our speakers so that you know who you'll be hearing from today. So first I'd like to present to you, because many of you know her, ALCA's own Kizzy Chambers. She's the founder and owner of R&R Care Management. She's a licensed clinical social worker and certified care manager. She has over 13 years experience in healthcare as a care manager and working in hospital settings. She's a psychotherapist focusing on depression, anxiety, stress management, and crisis stabilization. And as you know, she is a member of ALCA and the National Association of Social Workers. Her expertise in the geriatric population has made her well sought after, and her first priority is to treat and engage patients and their families with the same level of respect and care as her own. And I can say that knowing her, all of that is very true. And then our other speaker is Derek Mcdaniel. He is a nationally recognized elder care expert, published author, professional speaker, and consultant focused on elder care challenges faced by corporations and their employees. So he has a very distinct point of view that he can share with us today. In 2014, he authored the critically acclaimed book, Elder Care, The Essential Guide to Caring for Your Loved Ones and Yourself. And he regularly publishes articles in both Ebony, Huffington Post, and other publications. He has an MBA and a law degree, and he's admitted to the New York Bar and is a member of the National MBA Association and the American Bar Association and the Boulay. So let me be the first to welcome Kizzy and Derek.
Thank you, Abby.
Hi, thank you for having me.
You're very welcome. So we're going to start to jump right in. We have several questions for you on the topic of caregiving and the Black family. Derek and Kizzy are not only aging life care experts, but they either are or have been caregivers themselves in their lives. So they bring a really good perspective for us to listen to. So I'd like Derek and Kizzy to tell us a bit about their own caregiving experiences with their family members, and this will help set the context for our conversation.
Certainly. Derek, would you like to go first?
Nope, ladies first.
Oh, thank you. So my caregiver role started really young. As I wrote an article about, I remember being a child at 12 years of age, actually learning how to feed my grandmother through a feeding tube with a syringe. And that dates back to before we even had the actual type of tube feeding mechanics that we have now. And as a Black family, we believe that we took care of our own. So while our parents worked, my siblings, my cousins, we all stayed at home as young teenagers, taking care of my grandmother to keep her out the nursing home. So my caregiver actually started at the age of 12, learning a lot about how to care for my grandmother. And then as I became an adult, my caregiver role resumed with my mother, who had 2 open heart surgeries, dealt with breast cancer, and recently had a pacemaker placed. So I had to coordinate and intervene in a lot of perspectives and set up a lot of medical interventions to make sure she was looked after and kept safe. So my caregiver role even continues today with my mother.
Thank you for sharing that, Kizzy. Thank you very much. Derek, what has your caregiving experience been like?
Well, I was the primary caregiver for my grandmother. And as Kizzy mentioned, I had become a caregiver much earlier than I think I planned or even recognized, in the sense that in our family, with me and my grandmother, every Sunday afternoon, I'd have dinner at my grandmother's house religiously. Didn't matter if I was in New York, I went to her house for dinner. Over time, she started asking me to stop by the grocery store and do shopping for, or she'd ask me to do stop by the pharmacy and pick up her medications for. I didn't realize it at the time, and I'm certain that she didn't realize it at the time, but she was starting to say that those tasks were becoming too difficult for her. And so at that juncture, I became a caregiver unbeknownst to myself or to anyone else, that I was starting to become her primary caregiver. So I stayed in that role for probably 12 years until she passed away. And now I'm the caregiver to my uncle, and I share those caregiving duties with my cousin. So a lot of caregiving going on.
Yeah. Thank you for sharing that, Derek. The two of you have a lot in common, I'm sure, with those who are participants today. Many of the aging life care professionals that I know have been or are caregivers just like you have been. I too am an ALCA member and have been a caregiver twice in my life. So we know, not just from our professional experience, but also from our personal experience, what a tough role it is to care for someone you love who is aging and not well. So given that though, and given the poll that, that we had, it is really important, I think, to understand how to care for different populations from a cultural perspective. So the second question for you is, when it comes to caregiving, are there significant differences between African-American families and other families?
Well, I assume that question's coming to me. So yes, there very definitely are many differences, and just a few of the more significant ones. Number one, African-American families have a resistance to residential facilities, as Kizzy mentioned. More when I'm out speaking, I typically use this line. We have, as African Americans, as with other communities of color, we are much more likely to bring our mothers into our homes, or we're much more likely to bring our mothers into our homes than we are to put them in homes. So that's one very huge difference. Number two, African Americans are less likely to communicate with healthcare professionals. There's a legacy in this country of a distrust with the healthcare system. So that's another significant difference. In fact, let's see, in terms of the caregivers themselves, the average caregiver in the US right now is 49 years old. The average African-American caregiver is 44 years old. So they come into caregiving a little earlier. In terms of married versus single, African-Americans are about 33% in terms of married caregivers, whereas whites are 63%, Hispanics are 41%, Asians are 50%. So those are very different. So the concept of caregiving is different when you start looking at the different metrics. So in the interest of time, I'll stop it there, but it's a different caregiving picture overall.
Yeah.
Yes. And I agree. I think the common thing that we are going to notice throughout this discussion is the essence of the trust versus mistrust. And one of the big differences in caregiving services is that there's a sense of reciprocity. We took care of you as an older adult. Our family see that we raised you to take care of us in the time of need, and that's where the trust level is at. So there's a sense of obligation where that we feel obligated to take care of our loved ones, even if that includes moving them into our homes, or as Derek said, moving into their homes. But also you will find that with that there's more the statistic shows that we are more likely to do informal caregiving than formal caregiving. And what that means is we're more likely to bring in family members and neighbors, where other counterparts are more likely to hire someone to provide those services. And then there's a strong connection between the religious in the community. So the African-American group is more likely to connect with the religious group in the community than any other group, which makes a major difference when you're discussing caregiving roles.
Right, I would agree. So thank you for that, for those insights. While you were talking, we also launched our second poll. Here is really interesting information about those who are participating. So the question was, if you're serving African-American clients, from where are you sourcing your clients? So traditional marketing, 13% of us are sourcing clients via traditional marketing. The second is the largest response, 75% of us are sourcing African-American clients from current referral sources, meaning elder law attorneys, guardians, institutions, governments, hospitals, government programs and hospitals. And 25%, a full quarter, are word of mouth through current clients. And then there are between 4 and 6% of us that are receiving African-American client referrals through insurers or some other means. So also very interesting, but probably not unlike the population generally. Okay. All right, so let's move on to our next question. Because health is such a personal thing, when it comes to giving and receiving care, a high level of trust is really critical. So can you, Derek, talk about the belief systems that Black and Brown families hold that can drive decisions about reaching out for support when it comes to caregiving?
Absolutely. As Kizzy just mentioned, there's almost a cultural expectation that we as African Americans will take care of our older generations, and as such, let's see, how can I say this? In terms of building trust, there's the trust. There's multi-level trust actually. There's the trust that we're going to have in the subsequent generations that we will care for our older folks. Then there's the trust that we have in our communities, because as Kizzy touched upon, there's more of a sense of community in terms of our caregiving. There's the children, we have the neighbors, we have the church, we have other community institutions. So those all drive how we support our elders.
So, you know, I as you were talking, I was thinking about my practice really is a really interesting split between African-American families, Latino families, and white families. And 100% of the African-American families that I serve were sourced through church and those religious institution connections.
Well, in the African-American community, there's certain points of contact that have been and always will be incredibly influential. The church is quite possibly the single most important in terms of the African-American community. And with a lot of the speeches and things that I do, I've worked with churches either as the sponsor or with organizations where they've asked me to go into churches and speak, because the church is, in many regards, it is an establisher or a certification almost of reputation and influence within the African-American community. So, and just like with a lot of other communities, that culture that is created, that microcosm that's created within churches is incredibly powerful. And it is almost in terms of establishing trust, especially for people who are coming from outside the community. The church is probably it's definitely one of the best places to establish.
Yeah, I would agree. Kizzy, did you say something?
No, I was actually agreeing with what Derek has said, to develop those connections in the community.
Yeah, okay. So Derek, the next question here is for you as well. Are there strategies care managers can use to establish and build trust with African-American seniors seeking care or their caregivers?
Well, coming off the last one, the very first thing would be you're going to have to establish trust in terms of inside the community. The church is a great place to start. Second, you'll have to understand that there is a distrust of the healthcare profession in general, and by extension, the caregiving community, which folks are going to have to overcome. And so when I'm working with organizations, the first thing that I tell them is don't go in looking at the African American community strictly as a customer base, because that legacy of distrust is going to impede your process. And if you just walk in the door and try and sell them something, it's not going to work. Go in. For example, one technique that I suggest is become an information source. After establishing an introduction, let's say via the church, and there are other options as well as the church, but just to stay on the church example, after establishing your entry point, establish yourself as an information source, as a value-added partner before trying to turn them into customers, because you have to get over that initial distrust of, for lack of a better word, an exploiter of the community. You have to show that you're not there to just take from the community, but you're also there to give to the community. And once you've established that you're giving to the community, that goes a long way to establishing the trust that will be necessary for you to do business within the community. And one thing that was implied, but I think is really, really important that I make very explicit, that legacy of exploitation and substandard care within the African American community, in fact, in terms of many communities of color in this country, huge. We have some very famous examples of it, like the Tuskegee Experiment, where, and for those who are not familiar with it, in short, it was the National Health Service and the CDC got together and intentionally allowed hundreds of African American males to go untreated who had syphilis. They intentionally gave them placebos just to see how the disease would progress over time, and so that they could intentionally do autopsies on them afterwards. And that's one of the more famous examples, but it's not the only example.
Right.
And so there's a huge distrust within the African American community, and we're seeing it play out in more current times in terms of the COVID vaccine. Yeah. So there's a, to be kind, a hesitancy within the African American community to take the vaccine because of that distrust. So you're going to have to overcome that distrust, but it is worth it, because African American and communities of color, in terms of spending power, in 2018, it was just over $3.9 trillion. And that market is very much untapped. So it's worth getting over the hurdles, but there are some hurdles.
Without a doubt, I would just my own personal commercial for those of us who are serving African American clients, please do what you can to encourage your African American clientele to take the vaccine when it's their turn, and if they can, without the side effects that would prevent one from taking the vaccine. And while the rollout has been slow, more of a rollout has begun in African American communities, but as Derek has said quite clearly, much more needs to be done. And the care management, aging life care community can play a significant role. And then the last thing I'll say, and then I'll move on to our next question, is just to reinforce Derek's comments. I don't know if the book made our resource list, which we'll put up at the end, but in New York on our diversity committee, we are reading, or just finished reading, Just Medicine by Dana Bowen Matthew. It is a fantastic look at the cure for, potential cure for racism in the American healthcare system. It's excellent. So I would recommend that as required reading. So I think we're on to our next poll now, right, Courtney? Very good. So if you wouldn't mind taking our third poll, the question is, from what source are your African American clients paying for your services? So we'll take a moment as people answer that question quickly. Wow, you guys are fast. Thanks for that. Here we go. Interesting. So also probably not unlike many communities. So far, the winner is self-pay. So it looks like 63% of your African-American clients are self-pay clients. 29% are other family members, so still self-pay and not using another source for payment. 12% are insurance, maybe that's long-term care, and 18% are other. So thank you. I'm going to share those results. Okay. All right. Our next question is, so this is just an extension of the last, but going a little bit more deeply. We hear the terms cultural competence and cultural appropriateness used in relation to health and personal care. Let's explore what they mean in a care management context. So, Kizzy.
Yes.
When African American seniors and their loved ones are seeking care and interacting with doctors, what role does cultural competency and cultural appropriateness play?
The role is very important because as a trained social worker, I have learned you meet the client where they are. And the only way you can meet the client where they are is understand where they come from. So your first role is to ask questions. Ask questions and allow them to educate you because they are the expert of themselves. Yes, we are the care managers experts, but each individual is the expert of themselves. They kind of understand what's going on. So ask questions, find out what they know before you go in with a whole bunch of information. Assume nothing, all your assumptions, leave them at the door. All your judgments, leave them at the door. Those are very key when you're talking about cultural competence, but also understanding what the medical decisions are, how important they are. There are certain medical interventions that the African-American culture just will not do. And a lot of those medical interventions are related to religious purpose or cultural beliefs. So you need to understand that information before you make recommendations. Or before you try to coordinate services that can actually be defensive or offensive to an African-American person individually. Understand how important their religions are to them, their cultural beliefs. Not every person, not every African-American is very orthodox in their religion or their cultural beliefs. So don't go in with the assumption that because they are African American that they believe one thing or something different. As we all had the opportunity to be educated, that's inclusive of African Americans. So as they have been able to have access to further education, some of their beliefs have changed. So just going back and understanding and asking questions. Understanding that there is a lack of trust. I know our counterparts, they're tired of hearing about the historical, what I like to call generation trauma. They're tired of hearing about it and they wish the ideal that it goes away, but it's called generational trauma for a reason. And trauma doesn't go anywhere. So you have to understand that that lack of trust is going to be there. So you have to be able to understand that there's a lack of trust with doctors. There's a lack of trust with the nurses. There's a video and there's information out there about how there's a conversation between a nurse and a doctor and an African-American individual. And the nurse read the information and she talked with the African-American individual. And the information she obtained from that individual, she provided to the doctor as she's angry, she's hostile, she's non-compliant, she's wasting our time. So there was a lot of judgment in the fact that this is how this African-American individual was perceived, not looking at that this African-American has come from a history of mistrust and not trusting doctors and not trusting nurses. And so there was a lot of hesitant into communicating that information. So the biggest thing I can bring appropriate play, how it plays in is really understanding what our role is. What our culture is like, and you can't do that unless you ask questions and leave your judgment and assumptions at the door.
Right. That's great, Kizzy. You know, you make me think of something that I used to say when I was in managed care. And I used to say that it is hard to be sick and a person of color in healthcare and needing to interact with the healthcare system in my state. But then you add on top of that being aged being elderly, being a senior, that can triple the concern with interaction.
Correct.
So
And
Derek,
Abby,
yeah,
I'm sorry,
please.
just to add to that, I wanted to talk about understanding remedies. The African Americans they really believe in a lot of home remedies. And so it's not unusual, it's not uncommon to walk into a home where there are a lot of home remedies are being used, and that some of them are very successful. And because they're not modern Western technology that they use is often frowned upon. So understanding what those remedies are and how effective that those remedies have shown in many years historically.
Yes, absolutely, absolutely. I know that and this is no joke, my mother swears by chicken soup
Mm-hmm.
for many ailments, her homemade chicken soup.
Correct.
So Derek, let's get you in this conversation as well. This is another aspect of cultural competency and cultural appropriateness. Some of those some of our participants today have staff. How important do you think workforce diversity is in engaging in the aging life care industry? And are there strategies that private care managers and other aging life care professionals can use to diversify their staff?
Okay, so question number one is how important is diversity? Diversity is essential, not only in the caregiving space, but all across the board. And consistently, studies have shown that organizations that have a diverse workforce, number one, the productivity in their shop, whatever that may be, whether it be a large organization or a small one, productivity increases substantially. Diversity is essential in terms of helping people understand and communicate with new markets that they would like to get into. For example, some of the issues that Kizzy and you just mentioned, for example, in terms of understanding the history of why African Americans may have a reticence to deal with caregivers or the medical profession, and or understanding the home remedies. And by the way, ginger tea was huge in my family in terms of curing for illnesses. But in addition to all of those, helping people to understand and really, really communicate deeply inside of the community. That's probably the single biggest thing, because that communication, and there are many different examples of, some high profile examples of where companies didn't understand how to communicate with their audiences, and it led to some very, very embarrassing things, not to mention lost business. Probably my favorite example is the Coors Beer Company. Sometime back, they introduced a new beer, and they had a werewolf as the mascot. Well, with that mascot, they had a tagline that they spent millions of dollars on that said, "Turn it loose." Well, in Spanish-speaking countries, that translated roughly into "suffer from diarrhea." That's probably not the tagline that you want in anything that you're selling. Like,
I'd
hey,
say no.
no, buy our product, suffer from diarrhea. So, it's a funny example, but it's really easy to understand that probably had they had a Spanish-speaking person on the development team, they would not have spent literally millions of dollars promoting this all throughout the Spanish-speaking world, only to have to, number one, pull it out, spend more money apologizing essentially, and then trying to make good on it. So if nothing else, I give you that example. One, it's funny, but it's easy to remember why you need to have a diverse workforce. If you're trying to penetrate a diverse market, you're going to need people from that market, and not only people, but people in positions where they actually have a voice in what's going on. So,
Right.
because they need to be at the table so that they can help translate, help understand, help people or help organizations understand what they may not see because they don't have a sensitivity to it. So for all of those reasons, and I won't ramble on anymore. I'm looking at the clock here, but for all of those reasons, you need to have a diverse workforce. And if nothing else, just understand it this way: a diverse workforce is not about doing the right thing. It's actually from a business perspective, or in addition to doing the right thing, it's also profitable.
Yeah.
Yeah, and I agree, Derek. I also want to add that as medical professionals, I don't know how many other disciplines are actually chimed in to this discussion, but we must be the catalyst to bring diversity into the community. As care managers, especially, we have taken an oath of ethical in diversity and provide services to any individual. But in order to break that barrier that's there, we need to start hiring diverse individuals. We need to be the individuals that's actually starting that and bringing diverse workers into the community, and not looking and judging at the way they dress, the way they look, or the way they speak, because that's what I find are a lot of barriers, is that they don't look like us, or they may not be accepted into our families' homes. But it's our responsibility to help allow that to happen. So it has to start with us as well, especially if we are entrepreneurs, if we are CEOs, we are managers, we are in a position to do that. It needs to start with us.
Yeah. Yeah. Thank you. Thank you for those remarks, Kizzy. So since you're talking, let's keep you talking. So the next question is about the assessment that all care managers use. And so this is a really important tool that we use to understand the needs of new clients. So how can this tool, do you think, be modified to be more appropriate for African-American clients interested in care management services?
I think the tool is going to be modified based on the region, based on where you're located, because yes, African American as a culture as a whole, but based on where we live, we still have differences. So I think you need to understand your region, your culture, the culture of that African American, to modify your assessment too. But it should have sensitivity questions, making sure that your questions are unbiased and that they're sensitive to the person that you're speaking with, and making sure that your assessment take in consideration of religions, and asking that question: how important is religions to you? If you had to make a life health decision, how much of the religion will play into this information? I actually just did an article and we talked about healthcare surrogates and power of attorney. We are very notorious. African Americans, we may have a healthcare surrogate, we may have a power of attorney, but that doesn't mean that person is going to make the total decision. Many times, those decisions does include the client. And if the client is very adamant about something that they don't agree with, the power of attorney or healthcare surrogate will more likely go with that. So you have to make sure you understand who is the key support system to that client and establish that relationship, include them in that tool, ask a lot of questions from that individual. But I want to take it back a little bit more than that. I want to take it back to just as the business perspective. I remember working in corporate America, and we were required annually to complete cultural competence courses to understand what that means and what that looks like. So as an agency and an organization or business or practice, you should also have something in place, tools that you are incorporating to measure how well your employees are culturally competent, where they are. I actually saw one of the questions that talks about, I'm not religious, right? You don't have to be religious to understand religious and how important religious is to a family member. So there are tools such as the agency cultural competency checklist that you can use with your agency to understand what the lack of cultural competence is located at. There's another tool called Multiculturally Competent Service System Assessment Guide that can help you. And a lot of these questions on these two tools that I have given you, you can also incorporate that into your assessment with your population.
Very good. Thank you, Kizzy. I think those recommendations are good ones, and hopefully they're helpful to those of us who are serving an African American clientele. All right, so we're going to pick it up just a little bit because we want to leave some room at the end for questions. So I'm going to ask this next question of Derek only, and then the question after that will be for Kizzy.
Okay.
So this question is, what are well, let me set it up. And this is speaking more specifically about the COVID pandemic and how that's really put a hotter spotlight on racial disparities in the American healthcare system that range far beyond what's happened with COVID. So in your opinion, Derek, what are the overarching issues and barriers to care for African American families? We've talked about them some already, but are there any that you haven't mentioned or that you'd like to delve a little bit more deeply into?
Well, COVID, COVID in the African American community, just like anywhere else, it's a deadly disease, and people need to be better educated about how to protect themselves, protect their families, and as with many other things in the African American community that deal with health, the education level isn't there that it should be. And I'm talking about the education that comes from the sources of information. I'm not talking about the educational levels of the people themselves. Whether it be the CDC, the politicians or whomever, there needs to be a very consistent, very clear message and communication, or an educational program that helps people understand what the dangers are, how to protect themselves, where to go for help, how to source information. Well, that's in the African American community, or actually, I'm going to broaden it again. Communities of color, that education has not been there. And so that, I think, is a large part of why the COVID pandemic has been disproportionately large in the African American community. Obviously, there are other factors. I don't mean to say that there are not, but that lack of education is a big part of why the community has suffered more than need be.
Yeah. And right, absolutely. And so what you're speaking to is the ability for authorities to provide appropriate education at the right place, at the right time for communities of color, and in the right way.
In the way, exactly. I was about to point that one out. In the right way.
Communities of color, exactly. So that, thanks for that, Derek. So that really kind of gets to my next question for Kizzy, and that's, how can care management help fight against healthcare disparities? And that's really, what Derek is beginning to talk about. There are all of these systems that can appear to be and are lined up in a way that does not encourage healthcare access and other things that speaks to social determinants of health. But from your point of view, Kizzy, how can care management be used to fight against healthcare disparities that people of color might experience and be part of the solution?
The very first simple is we must be the greatest advocates. All right, we must advocate for our clients of color in a different way, to their understanding, that they see the value of the advocates. What we need. We need to help them break down those barriers, and the way we do that is let them know we understand where they come from. Listen to them and let them know that they are being heard. Find out what preference they like when you're talking about doctors. Some prefer Black, some prefer white, some prefer female, some prefer male. I know many of us have our favorite gerontologist, our favorite doctor for this, our favorite doctor for that, but that's your favorite doctor. Do they have a preference? And you're building trust through that by going with them and learning their doctor, who their doctor is, and why do they like that doctor? What makes that one particular doctor so important? I have a case where this person goes to this doctor all the time and the doctor does nothing but write prescriptions. But my client loves this doctor and will not leave the doctor. So I have to intervene in a different way when it comes to writing prescriptions that really is not necessary. I have been able to build a relationship with this doctor to help mitigate that, but I had to allow my client to continue to go to this doctor. So you have to understand and allow them to make some decisions and make some choices. Another thing we talked about was understanding their experiences and understanding how they have had interactions, bad or good, with medical professionals. What are their experiences? You may hear some horrifying stories that help you better understand why they prefer not to go to the hospital, why they prefer not to go to the doctors. So understanding those experiences with no judgment. And then the last thing I wrote here is we must work to reestablish or just to establish trust amongst African American, Black and Brown communities. I said this earlier, and I'm just going to reiterate this. The idea of being tired of hearing about historical generational trauma, you're not going to go over well with that. You have to leave your assumptions at the door. You have to leave your judgment at the door and understand why it's very traumatic for people of color to trust anybody. And so we have to walk with them and not in front of them. We have to show that this is a partnership. And you do that by walking with them, holding their hand, and not trying to lead them.
Yes. Thank you for that, Kizzy. You know, when we were talking about and planning this forum, one of the things that the Diversity Task Force talked about is how ALCA is really very interested in increasing diversity among its member population. But then beyond that, why, right? One, because ALCA is made better when different kinds of care managers are in the membership, but also it extends the reach and influence of the organization. It extends the reach and the interest in the kinds of issues that we advocate for, whether they're on the community level, on the state level, or the federal level. And it also helps us reach more people, which all of us want to be able to do. So understanding those people that we want to reach is the point of having this conversation. So thank you for all of that, Kizzy. So we're moving down toward the end of our conversation with our panel, and we'll open it up to questions momentarily. We do have a resource slide, which Courtney has put up right now. Thanks for that, Courtney. And these are recommendations that both Derek and Kizzy have put together for you, have compiled for you. And if you have interest in reading any more about some of the things that were said today, or getting more background on this topic, or on the topic of healthcare and Black and Brown people in the United States, these resources will be good for you to take a look at. So if you do a print screen, if you hold down Control, print screen, you should be able to copy it and paste it to another document, or take a picture of it with your cell phone, so that you have those available to you. So I wanted to ask, just in a final question, Derek and Kizzy, is there one final piece of advice that you each have for care managers who are serving African American families or have the desire to?
Yes. Mind if I jump in first, Kizzy?
No, go ahead. Go ahead.
Yeah.
Real quick, it's really just to reiterate what I said before. You have to establish that trust within the community first and foremost before you can look at it as a business opportunity, and leverage the influencers. And again, and I'm broadening it out by calling them the influencers, because it's not only the church. It could very well be partnering with maybe an organization like an African American organization or African American professionals to help you establish that trust and leverage the reputations that are already within that community to help you penetrate that market. So if I had just one thing to say, it would be that you have to establish trust and leverage the influencers that are already there, whether that be through the churches or partnerships with businesses or vendors or whatever, just to establish or to help you get your foot in the door and leverage the credibility of the folks that already have the credibility. It's the fastest and the best way to do it. So
Thank you, Derek.
Thank you,
Thank
Derek.
you.
My one take phrase I would tell you, I would say is self-reflect. Be honest with yourself. Identify, acknowledge, and address your own biases, your own stuff that you have, even those things that you avoid to discuss because it makes you uncomfortable. If it makes you uncomfortable, we can tell that you are uncomfortable. And it goes back to, if we are not comfortable with you, we are less likely to trust you. So don't be afraid to acknowledge that it's there. That is something that, systemically has been there, and we try to avoid these conversations, or we try to avoid reflecting on ourselves and asking ourselves that very important question. Am I prejudiced, which we all are in some kind of way to something? Am I racist? Do I have racist tendencies? Do I have racist thoughts? And if I do, how can I address those? So that way I can be a better medical professional and I can be a better myself, so I can build relationships in the community and become diverse as a diverse care manager.
Thank you, Kizzy. So before we go into the Q&A, which we will in just a second, I want to thank Derek Mcdaniel and Kizzy Chambers. I consider both of them friends, honestly. Derek is among elder care experts. He is one of the best that I know. So if there's an opportunity for you to engage with him, I would make the recommendation that you do. And Kizzy is my sister in this practice, and she's an elder to me in this practice as well. I depend on her advice. So thank you both for your time today and for your expertise. So now we'll dive into the Q&A. So this is an interesting question, I think, for you, Kizzy. Among African-American life care managers, what's been the pathway to the work?
Say that again, I'm sorry. Okay,
Among African-American life care managers, what has been the pathway to the work? I think meaning, how do we get there? What's the path to becoming an aging life care manager?
It's really starting, it's really having confidence. You have to understand what you're walking into. Unfortunately, majority of my clients are white Americans, but I do have some Black Americans on my caseload. But I had to make sure that I can connect with my white Americans just like I can connect with my Black Americans. So having confidence within yourself and walking into whenever you walk into something, walking in showing that you have value, that you're bringing in value and valuable options. When they see those opportunities, they begin to allow you, they begin to explore these opportunities with you.
Okay, thank you, Kizzy. Next question is, in interviewing people of color, how important do you think it is to emphasize that there is no wrong answer to your questions? That's an interesting question.
yeah, that's an interesting question. I would think that that's probably good for anyone, whether they're people of color or not. When interviewing people of color, I think, honestly, I think the same standards should be used when interviewing people of color. If anything, if anything, I think the interviewer has the obligation to try and understand that the person that they're talking to may have a different set of experiences, a different history, a different worldview, and just understand their answers coming from that worldview and see their differences not as a negative, but as a positive in that they may actually be able to expand the view of the organization. So I think that's probably how it answers.
Very good. So I'm looking through the questions. There are lots of requests, Courtney, for the slide, the resource slide to be put up again and to be emailed to participants. So as we wind down with one or two more questions, Courtney, maybe you could share that resource slide one more time with the group. It's a lot of great feedback for our two speakers and for this discussion today in the Q&A. Here's a good question. All of the questions are good, but here's the next question. In your experience, are churches good partners in helping the community stay safe and well for the purposes of protection from COVID or information about COVID? I certainly will allow Derek and Kizzy to respond as they will, but I will say that I know a number of churches that are providing webinars that speak to COVID to their congregations and the wider community, not only about the disease and how to prevent it and keep yourself and your family safe, but also to encourage getting the vaccine, but not just to say, get the vaccine. That's not the point. The point is to educate about what the vaccine is, what the mRNA vaccine is, what that technology is like, so that people understand how it works and why it's effective, as opposed to just saying, trust us, but actually educating people on, despite the fact that the vaccine was pushed to market so quickly, why the efficacy levels are so high, and how that technology is new and how it's enhancing the way that we approve drugs in this country, but specifically about these vaccines. Take it, but these are the reasons why you should. And by the way, this is why it works, and this is why it won't make you sick from something else.
Yeah.
I don't know if Derek or Kizzy have any other responses about COVID as it relates to the Black church and the place of the Black church.
Yeah. I can speak. I know my dad, that's where he actually was able to go get his COVID shot, where in Florida and Orlando, the logistics was just terrible. And a few of the African-American churches were able to establish a setup there where a lot of in the African-American communities where they had access to that information. So they are doing a lot depending on your region where you are. But also, many of these churches have different departments within the churches that focus on mental health, that focus on health. They have church members who are doctors, who are nurses, who are a higher professional that they are utilizing to help cultivate this information. So yes, I do believe that they are a great connection in the community.
And I'd like to second what both of you said and come at it from a slightly different perspective. My short answer would be yes, the churches are helping with COVID, but I think what's also important is understanding why the churches have the power and the influence that they do have. And it really goes back to the points that we've been discussing over the course of this discussion today. The churches, and to Kizzy's point, I'm just going to say it slightly differently. The churches have the resources so that people can go there and feel comfortable that the information that they're getting from the church is accurate, that it has been vetted, and that they can trust it. And if the church has that, and which they do, that's really a great template that organizations can use to access the community. Not only just using the church to access the community, but take that template, provide information, develop trust, be seen as a resource so that folks within the community trust you, and they will come to you and want to do business with you, such that you won't have to so much go to them, they'll actually come to you. But understand, you have to provide value in addition to just services.
Right. Thank you, Derek, and thank you, Kizzy. So before we close, I think there's one more poll to put up, and that really is just to get some feedback from you, although we appreciate all of the very positive feedback that many of you have put into the chat. If you could take a moment before you sign off to just answer a few more poll questions, we would really appreciate that. And again, we appreciate your time. Thank you so much for participating today. Thank you to our panel, Derek and Kizzy, and for sharing your keen insights. We will also get the slide. Hopefully, I think we can get it posted to the website, and we'll look into seeing if we can also have an email to those who participated today.
And well, thank you for having me today, Abby. And just a quick plug for you. I know you spoke about how highly you regard us. Well, I hold you in the highest regard as well. And you are amazing at what you do. And thank you for the things that you've taught me about being a care manager. So very definitely a trusted resource and someone that I'm happy to call a friend, actually privileged to call a friend. Thank you.
Thank you.
Thank you, Derek.
Hey, Abby,
Thank
Kizzy, and Derek, thank you so much. Do you want to release the last poll, and then I'll thank everybody for attending. This was fantastic.
The poll is up.
So thank you everyone for attending. We hope to have many more of these. Thank you again to the task force and all their vision in helping us put this together. Derek, thank you so much for joining us. And of course, Kizzy and Abby, members, for doing this too. It was great. Everyone have a great afternoon and a nice evening. There's the poll.
Yep. Nice meeting you, Derek.
It was nice meeting you, Kizzy.
Thank you.
Thank you, everyone.
Abby. Thank you.
Stay well and safe.
Stay well. Take care. Everyone have a great day. Bye-bye.
Bye-bye.
Take care, everyone.